Hola, buen día. Hola, buen día. ¿Cómo están?
Hi, how are you? Thank you so much for having me here. I'm very happy to participate in this event and to be able to present the work that we have been working on for about 20 years now, almost 20 years, and the work that we have been doing in terms of fighting for our rights in terms of therapeutic use of the coca leaf. Okay, would you be able to give me the permission so I can share my screen? I have a presentation. I have some images to help support my presentation. Okay, so in terms of the seminar, what we are really seeking to do is to like Mr. Baldomero, what we are working on is trying to see what exactly is going on with the coca leaf. And while we have been using it for 5,000 years, that the coca leaf has been being used traditionally, what are the technical regulations that need to be adapted? So what does this mean? Everyone who uses the coca leaf, many people in the Andean region, people use it for a long time for many different uses, to treat different illnesses, to help them psychologically. So what we want to do here is to understand what are the regulations and the norms in terms of the use of coca leaf. What would be the risk factors and the things that need to be known from a medical perspective. So here we have Dr. Jorge Hurtado and Joop Women, who are two clinicians who are working with us. And so what is the main topic here? It's the impact of the coca leaf on health. And we want to approach this from an academic perspective. So just to start with a little bit of history, during the pre-Columbian era, the coca leaf was used as a stimulant to help give energy, also for digestive issues, for nosebleeds, headaches, different wounds, also used as a sexual stimulant, also a topical anesthetic, and to help people be more resistant to hunger. And so we have a lot of historical testimony on the part of anesthetists from the indigenous peoples in Peru and Bolivia, who knew very well the properties of the pharmacological properties of the coca leaf. And so this is something that we can actually see in the historical record in the medical community during the pre-Columbian era. Then during the colonial era, the Spaniards reached Latin America and established their settlement in San Luis Potosí. And now this is where we begin to see the criminalization of the coca leaf. We see the first attempt to eradicate and prohibit the use of the coca leaf during these years, starting in 1551. And they really the indigenous populations were able to reintroduce they wanted to reintroduce the use of the coca leaf for its stimulating properties. So the coca leaf has been industrialized for over a century at this point. In 1855, the alkaloids were first extracted successfully. And here we have a picture where we can see, we want to emphasize what would be the difference here between the components. Here we have the methylbenzoline and the coca leaf, and then we have the hydrochloride of the methylbenzoline, and this is the chlorhydrate of the coca leaf. And then here we also have the sulfate, which is a much larger molecule. So moving on to the 19th century, 1884, Freud with he's famous, of course, for having pioneered psychoanalysis, but he was also a researcher. He studied the coca leaf in addition to his psychoanalysis work. And here in his work, in his writings, we see that he says that the coca leaf it elevates mood. It gives you a sensation of safety, of confidence, of self-actualization. It also can help with muscular strength, give you a greater capacity to work, and it can be a treatment for depression, alcoholism, addiction to morphine, asthma, gastrointestinal issues, and an aphrodisiac. And then in 1884, Kohler started using the coca leaf as an anesthetic for eye surgeries. So in this time period, we didn't have the anesthesia that we do today. So the coca leaf was revolutionary for the medical world to be as a pain reliever and an anesthetic. So chlorhydrate of cocaine was legal for many years and was produced exclusively in Germany. So here we see how it starts to move from the prehistorical period and move into the post-colonial period. However, apart from its anesthetic characteristics, there are also different side effects. And we start to see different products that were also starting to appear around this time. Like, for example, this Mariani tonic that we can see here. And so the first drink that we see in history is this one, where it's recognized that the use of, this is when the coca leaf was most important during, it was at its peak in terms of medical usage. And all of the benefits that it was able to impart in a medical context. And so here we have like a gold medallion that recognizes the benefits of this wine tonic. And here the Pope actually also gave his recommendations. And then here John Pemberton, who was a pharmacist from Atlanta, he imported this Vino Mariani to the United States, where it was known as French wine coca. So this French wine coca, which was John Pemberton's invention, was used as a stimulant, and we see its use in the United States during the Prohibition era, when alcohol was prohibited, and during this time period, Pemberton wanted to create a new drink, which today we know as Coca-Cola. And it was the second product that was directly derived from the coca leaf. And something very important that Pemberton did, he said that using the coca leaf can help preserve the health of everyone who uses it, prolong their lives for many years, and enable its users to improve their physical health and have a very prodigious mind. So again, he is extolling the benefits of coca leaf on the human body. So other people were also benefiting from coca here, and at that time period, it's actually the basis of modern geriatrics. So as you may already know, geriatrics is the study of aging. And what we seek to do in this field is to try to combat the effects of aging, the negative effects of aging. And so here People were trying to treat, for example, pain from rheumatoid arthritis, and they found that the coca leaf or its derivatives could not only help with pain, but also help improve mental mood and mental well-being in general. In addition to being useful for gastrointestinal problems and urinary tract infections in these geriatric patients. So it helps the functioning of this central nervous system. And these are all the commercially advertised benefits of cocaine or the coca leaf during these years. So they really say that it helps the entire body, not just one part, but rather it's really a comprehensive. This is what they're saying. So it's really propaganda. They're saying that cocaine is like a panacea, it's like a cure-all, and cocaine was actually the most marketed or most commercialized substance during this area. And this is very important to note because we currently, remember, we are in a context of prohibition in the United States during these years. So even with that, the cocaine was still being marketed all around the world. And so they said the effect of GH3 is only comparable with the effects of the use of coca leaf by indigenous population in the Andes. Now, moving a bit forward, we have two studies that are a little bit more modern. In 1975, there was a very important study by Drs. Plowman, Ehrlich, and Duke, in which they show that coca, here this headline says, coca is the best food in the world. They say that the leaf has fewer calories, more protein, more fiber, more calcium, more phosphorus, more iron, more vitamin A, and other vitamins. And so here, for example, in this table, which they had used, they have compared the proteins in the coca leaf with other foods like quinoa, which is one of the most important foods in the Andes for its nutritional value. So here they're comparing, and you see that the coca leaf has more protein than quinoa and amaranth. Also, we see there's much more calcium, 1,749 milligrams as opposed to 99 milligrams in amaranth and quinoa. So we see that it is much higher also in phosphorus, also iron. Another study, this is a study a little bit more clandestine, but this was submitted to the World Health Organization by the Institute of the UN Institute for the UNODC or the UNICRI. And here they found that the traditional usage of the coca leaf among indigenous peoples does not have negative health effects. So that's kind of where it was left. This was in years 1992 to 1995. But it's important to emphasize that this traditional use, this is something that we have, there's a history of over 5,000 years of traditional use of the coca leaf. And there are many the cultures that are indigenous to this region have shown really have so much knowledge about this usage, and we can learn from them that it really doesn't have negative effects. So moving on from this, here we have a response to all of the purported uses of the coca leaf. Here's another more modern study by Dr. Whale in 1979 from the University of Harvard on the therapeutic value of the coca leaf in contemporary medicine. So he also affirms that it is useful for gastrointestinal sicknesses, to help the body, to help the throat, different dental and mouth oral diseases, also for diabetes, also to help reduce weight, to lose weight. It could work as an antidepressant, also to help wean off of stimulants. I think that one of the most important studies, I will show you a book in a bit that I have here with me, but I think one of the most important studies was one carried out by the University of San Andres at the Institute of High Altitude Biology, together with an institute in Paris. And here they did a very comprehensive and well-structured study. And these are findings that can be replicated in any laboratory and any place in the world. Well, these are findings by the IBA, which is the Institute for High Altitude Biology in Bolivia. So we have coca leaf contains 3 different alkaloids. We have cocaine, of course, then cinnamyl-cocaine and transinamyl-cocaine. And this is something that we hadn't mentioned earlier in previous century. So they also find that it improves capacity to work. It also has a stimulating effect on the respiratory system. It helps. It also helps with blood clotting, and as well with regulating glucose within the body. And that it doesn't, something very important that they also said, is that the coca had been criminalized because they said that the indigenous peoples in this part of the world were malnourished. They were malnourished. They weren't eating well enough, and they were poor. This was the narrative. They were framing it. They were saying that it was the cause of poverty in Latin America. But however, we see with this study that the daily use of the coca leaf did not have any negative effect on the nutrition of who are taking it. So here we have a phytochemical study. The phytochemistry of what is present within the coca leaf. And here, again, they found that coca enables people to work harder and more effectively. And then I'm kind of skipping here because we don't have too much time. And here we see the caloric distribution between protein, carbohydrates, and fats. So in summary, its effects, as corroborated by the Bolivian Institute, is that it helps with oxygenation, it helps utilize glucose or sugar, it reduces the viscosity of blood, it helps people's tolerance to exercise, it doesn't affect food intake, and it also aids people in being able to adapt to a very high altitude climate. So here we have a lot of findings that can really be used to help advocate for the use of the coca leaf. Another finding that we've been seeing since the 80s, 84, I believe, the coca leaf is an antidote against the use of cocaine. So in this proposal is that chewing the coca leaf is a good alternative for cocaine substance use disorders. It's something that it was carried out. It's a study that was carried out in 50 different people, and after 28% were able to adapt and successfully integrate into society at the beginning of the study, and after treatment with the coca leaf, this figure rose to 48%. Then, in terms of mental well-being, before treatment, it rose after treatment to 18 out of 50 patients who had improved mental well-being. So again, important, because here we have a proposal for treatment for people who are dependent on cocaine. So instead a natural treatment, an alternative treatment without needing to use other pharmaceuticals. So to conclude, how does the coca leaf affect the human body? This is very important to understand, because here we have this is really the fundamental problem at the end of the day. You know, this is something that's been very politicized. There was a banker who owned a pharmacy. There are a lot of third-party interests in the coca leaf. They've been third-party interests rather than interests in marketing it, rather than interests in health benefits. Even though it's something that's been used therapeutically for 5,000 years in Latin America. So here we have 3 different alkaloids that compose the coca leaf, and they're only in 0.5% of the coca leaf. And those are the 3 most important properties. This is the molecule that is within the coca leaf, methylbenzocholine. And in terms of the effect on metabolism, here we have the hydrolysis, and after that we have conine and benzoaconine. And those are the 2 main interactions that we have within the organism, the human body. And those are the main ones that we need to know. And then in addition to this, there are more recent studies where scientists have looked at what happens if we administer the metabolites of the coca leaf in our body. So here we're talking about these 2. So Dr. James Wynn from the University of California carried out several studies and was collecting data on these metabolites of the coca leaf. And he found that what the ancient or a more traditional older doctors from different from ages past, that it was true what they said, that there were not negative effects as long as the use is or what I'm trying to say is that according to modern science, in which they had to do they had to carry out a rigorous study that that follows the norms for scientific research, and they found that patients recuperated between 30 to 50% of their joint range of motion when the coca leaf was being used and applied topically for patients with rheumatoid arthritis. And then we have other findings that we can look at in the literature. Like, for example, in 1975, here we have some preclinical trials in animals where when they administered benzoylecgonine, 250 milligrams per kilogram, which is incredibly high. This is a very high. Here we're talking about pharmaceutical concentrates. It's a lot more than you would get in an actual traditional use. And even then, there were no negative effects on the cardiovascular system. Same with the chlorhydrate of cocaine, 20 milligrams, and did not have negative effects. So there are quite a number of studies in which we see that these metabolites they do spread throughout the organism or throughout the body, but they don't without any notable negative effect. So, for example, agonine does not cross the hematoencephalic barrier. We're just going to skip these slides. In 1994, a study by Branch and Kumpfer, where they found that there were no effects on the nervous system and no stimulating effect on the central nervous system, while the chlorhydrate of cocaine does have these effects on the nervous system. Here in 1992, Sandberg and Orphan, they find that the cocaine chlorhydrate, so when cocaine chlorhydrate is administered in mothers, it is not observed in the plasma of the fetus and in the amniotic fluid. So here we're seeing that it could potentially even be used to treat pregnant women. And in terms of studies in humans, here we have a study where they found that there were no negative effects on diastolic pressure, cardiac frequency, body temperature, pupil dilation, or the overall well-being of the body. And there was, after 2 hours, there was a clinically insignificant increase in systolic blood pressure. And so what this means is that when administered in a therapeutic system, therapeutic setting, there is no negative effect on the human body. Here, something else important that we are going to mention again later, metabolites have an immunoregulating effect on the B cell lymphoblasts. And so, basing ourselves in all of these studies, we at ICORI, which is the International Coca Research Institute, founded between researchers in the Netherlands and Bolivia, as well as Coca Wasi, which is the Coca Leaf Center in Yungas, Bolivia. We have been collaborating, studying different pathologies, using all of this scientific backing that we have, these studies from the literature that our colleagues have done over time. So we are using, what we're doing is we are using the coca leaf to treat osteoporosis, reflux, rheumatic arthritis, other autoimmune disorders, to treat diabetes, weight issues, and of course, treatment to cocaine addiction. And this was something that was overseen by our psychiatric doctor. So in the preliminary studies that we are working on, I'm going to give you some numbers. We have about 10 to 20 patients we're studying at the moment. But for now, the preliminary findings are that the systematic controlled therapeutic use of coca in accordance with medical protocols is that their blood sugar levels are much better controlled, and there's also they're also using different oral substances much less. In terms of rheumatic arthritis, here we see a decrease in the dosage of medication that they need to use upon treatment with the coca leaf. And what we're trying to do here is to decrease the dosage that they need to treat their arthritis. And the exact dosage is very individual. It depends on the patient. But they're very, very small amounts that we're talking about here. The same for lupus and systemic lupus. Here we're using it in an immunological context. And we have been able to reduce the dosage of medications that patients are taking for erythematous systemic lupus when when supplemented with therapeutic use of the coca leaf. So, several studies have also been proposed so that the medical community will hopefully accept that the use of the coca leaf or the pharmacological metabolite of it can be used medicinally. However, these studies are very small. They often have a very small sample size, and but sometimes it's difficult. Because sometimes you have someone who comes once a month. They say that they take it. The most important thing is that the patients are improving. So when we see improvement, patients are much more likely to cooperate with the treatment protocol, which is of course very important. In terms of weight issues, we find that it helps that the controlled consumption of coca flour when taken before meals helps with weight loss. And this is something that we are, as I said, we're helping. We are successfully helping patients lose weight. And this is, of course, in the context of a society in which obesity is one of the biggest pandemics. And also for osteoporosis, the coca leaf can help improve levels of bone mass when administered after systemically taking coca flour and when combined with regular physical exercise. In terms of gastrointestinal reflux, the first patient that we had was actually Dr. Hurtado himself, because when he tried the first pills that we had created, he noticed that it helped relieve these symptoms. So these are studies that can't be carried out in our countries because we don't have the funding to be able to carry out really comprehensive studies. We only have what we can see in clinical practice. But we are observing that when coca is consumed prior to meals, it really does help with acid reflux. And here one more thing that's important. Dr. Hurtado has designed a specific method for extracting the active metabolites without modifying them. And these are what are responsible for the beneficial effects of the plant when they are mixed in specific portions. So he has invented these pills, which are called ahayo. And in the next roundtable, they're going to speak a little bit more about what these ahayo pills really mean. So just to briefly go over it, with these ahayo pills, which again are a composite of a very specific proportion for the different metabolites of the coca leaf. From 1995 to 2005, 157 patients began treatment. There were 63 who qualified as being addicted to cocaine, and 944 were considered as having substance use disorder in terms of cocaine. They all agreed, consented to treatment, They consumed little sweets, little caramels with ajillo inside. And so with these ajillo pills, we found that there was a 30% improvement across patients after 12 months of treatment. So maybe one of our psychiatrist colleagues will be able to more on this. So just to conclude, due to the pandemic, we have seen. Could it help with COVID? Could the coca leaf help with COVID? That's the question that we have now. And I think so. We are currently using it with patients who have had COVID, who have had long-lasting negative effects, or long COVID, as it's known. So, what could be the benefits, the potential benefits of the coca leaf for people who are suffering from long COVID? And that, I think, is a very interesting question to explore. So, going back to the 1997 studies carried out by IBA, in terms of oxygen to the system, it really helps with the respiratory system. It also has it helps regulate the immune system, and so there's good indication that these are still observations, but there's good indications that that this could help with long COVID as well, and it's something that that we are currently working on. So that's what I wanted to present to you today. Maybe to compare cocaine with the coca leaf. And here there are some reports from studies that have been carried out with procaine and the or GH3 compared against the coca leaf. So procaine is a modification of the coca leaf, but it has the same properties. It helps physical and mental well-being and health in general. It can be used to help treat diabetes, depression, etc. So that's what I wanted to share with you. And maybe afterwards we will be able to speak a little bit more about how really, the coca leaf is not cocaine. There's only one molecule in difference, but this carbohydrate that is added to the molecule that we have makes up the coca leaf is something that makes it 1,176 times more water soluble. So it's like over 1,000 times stronger. Thank you so much, Roxana.